Welcome to your guide for administering SAPHNELO anifrolumab-fnia. This video is intended for qualified healthcare professionals who administer SAPHNELO injection for intravenous use. This video will demonstrate the steps for the preparation of the infusion and administration of SAPHNELO. SAPHNELO is a type 1 interferon or IFN1 receptor antagonist indicated for the treatment of adult patients with moderate to severe systemic lupus erythematosus or SLE who are receiving standard therapy. The efficacy of SAPHNELO has not been evaluated in patients with severe active lupus nephritis or severe active central nervous system lupus. Use is not recommended in these situations. SAPHNELO injection for IV use must be diluted prior to administration. The recommended dosage of SAPHNELO is 300 milligrams, administered as an IV infusion over a 30-minute period every 4 weeks. If a planned infusion is missed, administer SAPHNELO as soon as possible. Maintain a minimum interval of 14 days between infusions. SAPHNELO is supplied as a single-dose 2 ml vial containing 300 milligrams per 2 milliliters of anifrolumab-fnia. SAPHNELO must be stored in a refrigerator in the original carton to protect it from light. As you store and handle SAPHNELO, be aware that the vials should not be frozen or shaken. Before you start, gather your supplies, which will include a syringe to transfer SAPHNELO from the vial to the infusion bag, a 50 milliliter or 100 milliliter of 0.9% sodium chloride injection USP infusion bag, a single-dose vial of SAPHNELO containing 300 milligrams per 2 milliliters of anifrolumab-fnia, an infusion line with a sterile, low-protein binding 0.2 to 15 micron inline or add-on filter, and an IV flush of 25 milliliters of 0.9% sodium chloride injection USP at the end of the infusion. Review the administration procedure and explain that SAPHNELO will be administered intravenously over a 30-minute period after an IV is started. SAPHNELO is supplied as a single-dose vial containing 300 milligrams per 2 milliliters of anifrolumab-fnia and must be diluted before infusion. When preparing the diluted infusion solution, use aseptic technique and follow these steps. Do not shake the vial. Visually inspect the vial for particulate matter and discoloration. SAPHNELO is a clear to opalescent and colorless to slightly yellow solution. Do not use and discard the vial if the solution is cloudy, discolored, or contains particles. Begin by withdrawing and discarding 2 milliliters of solution from a 50 milliliter or 100 milliliter 0.9% sodium chloride injection USP infusion bag. Next, withdraw 2 milliliters from the SAPHNELO vial. Then add the 2 milliliters from the SAPHNELO vial into the infusion bag. Mix the solution by gently inverting the bag. It's important that you do not shake the bag. Each vial is intended for single use only. If any concentrate remains in the vial, discard it. Administer the infusion immediately after preparation. If for some reason the infusion solution cannot be administered immediately after preparation, you have 2 options. 1. Store it at room temperature for up to 4 hours. Protect from light. Or 2. Refrigerate the diluted solution of SAPHNELO for up to 24 hours. Do not freeze. Protect from light. If refrigerated, allow the diluted SAPHNELO solution to reach room temperature before you administer it. You'll administer the infusion solution intravenously over a 30-minute period through an infusion line containing a sterile, low-protein binding 0.2 to 15 micron inline or add-on filter. Do not co-administer other medicinal products through the same infusion line. If a serious infusion-related or hypersensitivity reaction such as anaphylaxis occurs, immediately interrupt the administration and initiate appropriate therapy. After completing the infusion, flush the entire infusion line with 25 milliliters of 0.9% sodium chloride injection USP solution to ensure all of the solution for infusion and the complete dose of SAPHNELO has been administered. Dispose of any unused medicinal product or waste material in accordance with local requirements. Please listen to the important safety information for SAPHNELO. Contraindication. Known history of anaphylaxis with SAPHNELO. Warnings and precautions. Serious and sometimes fatal infections have occurred in patients receiving immunosuppressive agents, including SAPHNELO. SAPHNELO increases the risk of respiratory infections and herpes zoster. Use caution in patients with severe or chronic infections. Avoid initiating treatment during an active infection and consider interrupting therapy in patients who develop a new infection during treatment. Serious hypersensitivity reactions, including anaphylaxis, have been reported following SAPHNELO administration. Events of angioedema have also been reported. Other hypersensitivity reactions and infusion-related reactions have occurred following administration of SAPHNELO. SAPHNELO should be administered by healthcare providers prepared to manage hypersensitivity reactions, including anaphylaxis and infusion-related reactions if they occur. Immediately interrupt administration and initiate appropriate therapy if a serious infusion-related or hypersensitivity reaction, such as anaphylaxis, occurs. There is an increased risk of malignancies with the use of immunosuppressants. The impact of SAPHNELO on the potential development of malignancies is not known. Avoid the use of live or live-attenuated vaccines in patients treated with SAPHNELO. SAPHNELO is not recommended for use in combination with other biologic therapies, including B-cell targeted therapies. Adverse reactions. The most common adverse reactions, those having an incidence of at least 5%, are nasopharyngitis, upper respiratory tract infections, bronchitis, infusion-related reactions, herpes zoster, and cough. In the controlled clinical trials, the incidence of infusion-related reactions was 9.4% in patients while on treatment with SAPHNELO and 7.1% in patients on placebo. Infusion-related reactions were mild to moderate in intensity. The most common symptoms were headache, nausea, vomiting, fatigue, and dizziness. Use in specific populations. A pregnancy exposure registry monitors pregnancy outcomes in women exposed to SAPHNELO during pregnancy. For more information about the registry or to report a pregnancy while on SAPHNELO, contact AstraZeneca at 1-877-693-9268. There are insufficient data on the use of SAPHNELO in pregnant women to establish whether there is drug-associated risk for major birth defects or miscarriage. Advise female patients to inform their healthcare provider if they intend to become pregnant during therapy, suspect they are pregnant, or become pregnant while receiving SAPHNELO. No data are available regarding the presence of SAPHNELO in human milk, the effects on the breastfed child, or the effects on milk production. The safety and efficacy of SAPHNELO in pediatric patients less than 18 years of age has not been established. Indication. SAPHNELO is indicated for the treatment of adult patients with moderate to severe systemic lupus erythematosus, or SLE, who are receiving standard therapy. The efficacy of SAPHNELO has not been evaluated in patients with severe active lupus nephritis or severe active central nervous system lupus. Use is not recommended in these situations. Please see full prescribing information, including patient information, at saphnelohcp.com.